Hi friends, welcome to my channel Nursing Guru 24. Today we will discuss about some frequently asked questions in nursing competitive exams like RRB, ESIC, etc. If you like this video, please do subscribe, share and like the video. Let us start with first question. Which part of the brain regulates respiration? The options are cerebrum, cerebellum, medulla oblongata, hypothalamus. First we will see the meaning of these options or alternatives. First I told cerebrum. What is cerebrum? We all know cerebrum is the largest part of the brain and is responsible for higher level functions like thought, perception and some voluntary movements. Next one, cerebellum. Cerebellum is located behind the cerebrum and is responsible for coordinating movement and balance. Then I told medulla oblongata. Medulla oblongata is located at the base of the brainstem and is responsible for regulating some important functions like respiration, heart rate and blood pressure. It contains respiratory centers that control the rate and depth of breathing. Next one, hypothalamus. As we all know, hypothalamus is responsible for regulating body temperature and hunger or thirst. From above explanation, it is clear that the correct answer is medulla oblongata. Medulla oblongata regulates respiration. Next question is, what is the normal tidal volume in a healthy adult? Options are 100 ml, 500 ml, 1000 ml, 1500 ml. What is tidal volume? Tidal volume is the amount of air inhaled and exhaled during each breath. In a healthy adult, the average tidal volume is around 500 ml. Hence, the correct answer is B, that is 500 ml. Next question. The functional unit of the kidney is? Options are nephron, glomerulus, loop of Henle, collecting duct. The correct answer is A, that is nephron. What is nephron? Nephron is the functional unit of the kidney responsible for filtering blood and reabsorbing needed substances and secreting waste products to form the urine. The other options are incorrect because glomerulus, loop of Henle and collecting ducts are the parts of nephron. What is a glomerulus? Glomerulus is a network of capillaries within the nephron, within the glomerular capsule that filters blood. Then loop of Henle is a part of nephron that helps to concentrate urine. What is collecting duct? Collecting duct is a tube that collects urine from multiple nephrons and carries it to the renal pelvis. Hence, the correct answer is nephron. Nephron is the functional unit of the kidney. Next question. What is the primary goal of nursing management in a patient with COPD? Options are increase oxygen consumption, improve oxygenation and reduce carbon dioxide retention, cure the disease, reduce the heart rate. The correct answer is B, that is improve oxygenation and reduce carbon dioxide retention. Here is why. What is COPD? COPD refers to chronic obstructive pulmonary disease. Is a condition that causes difficulty breathing due to narrowed and damaged airways. COPD is a condition that causes difficulty breathing due to narrowed and damaged airways. This leads to hypoxemia and hypercapnia. What is hypoxemia? Low levels of oxygen in the blood. What is hypercapnia? High levels of carbon dioxide in the blood. Hence, nursing officer should focus on improving oxygenation by providing supplemental oxygen to increase oxygen levels in the blood. Reducing carbon dioxide retention. This helps the patient to exhale effectively through some techniques like deep breathing exercises and airway clearance methods. Hence, the correct answer is improve oxygenation and reduce carbon dioxide. Let us look at why the other options are incorrect. Increase oxygen consumption. Instead of increasing oxygen intake, the primary goal is to ensure the body can effectively use the oxygen available. The next option, that is cure the disease. Unfortunately, there is no cure for COPD. However, management focuses on slowing its progression and improving quality of life. Reduce heart rate. While a rapid heart rate can sometimes be a symptom of COPD, it is not the primary focus of nursing management. Improving oxygenation and reducing carbon dioxide retention are more important for overall health and well-being. Next question. Which electrolyte imbalance is common in patients with diarrhea? Which electrolyte imbalance is common in patients with diarrhea? Options are hypernatremia, hypokalemia, hyperkalemia, and hypercalcemia. The correct answer is B, that is hypokalemia. What is hypokalemia? Hypokalemia is the condition in which there is a lower amount of potassium than normal in blood. Hypokalemia is the condition. Hypo refers to decreased level. Hyper refers to increased level. Here, hypokalemia is the condition in which there is lower amount of potassium than normal in blood. We all know diarrhea can lead to significant fluid and electrolyte losses, including potassium. Why potassium is needed in our body? Potassium is essential for muscle contractions and nerve impulses. When potassium levels drop, it can cause muscle weakness, fatigue, and heart problems. Hence, the correct answer is hypokalemia. Why other options are incorrect? Because hypernatremia, in which there will be high blood sodium levels, which is less common in diarrhea. Then hyperkalemia, this is high blood potassium levels, this is not associated with the diarrhea. Then hypercalcemia, high blood calcium levels, this is also not associated with diarrhea. Hence the answer is hypokalemia. Next question. Which drug is used to treat anaphylaxis? Options are atropine, epinephrine, dopamine, lidocaine. First we will see the meaning of anaphylaxis. What is anaphylaxis? Anaphylaxis is the severe life-threatening allergic reaction. Anaphylaxis is the severe life-threatening allergic reaction to an stimuli. For example, bee sting. Bee sting sometimes may cause life-threatening allergic reaction. Here the answer is B, that is epinephrine. Epinephrine is also called as adrenaline. Adrenaline or epinephrine is the first line treatment for anaphylaxis. It quickly reverses the life-threatening effects of an allergic reaction like constriction of airways, low blood pressure, hives. Hives means itchy rashes. The other options are incorrect because, as we all know, atropine is used to treat bradycardia, that is slow heart rate. Dopamine is used to treat hypotension, that is a low blood pressure in some conditions. Lidocaine is used to anesthetize the local part. It's used as local anesthetic. Hence, the correct answer is epinephrine. Next question is, what is the antidote for opioid overdose? What is the antidote for opioid overdose? Options are naloxone, flumazenil, atropine, protamine sulfate. As we all know, opioid analgesics or opioids are pain-reducing medicines. Examples are morphine, codeine, fentanyl, etc. Here, the correct answer is A, that is naloxone. Why naloxone is used? Naloxone is a medication that rapidly reverses the effects of opioid overdose, such as respiratory depression, unconsciousness, coma, etc. The other options are incorrect because they are not used for opioid overdose. I told flumazenil. Flumazenil is used to reverse the effects of benzodiazepine medications. Atropine, as I told, atropine is used to treat bradycardia. Then protamine sulfate is used to neutralize the effects of heparin, that is anticoagulant. Next question. What is the main mode of transmission for tuberculosis? That is TB. Options are blood-borne, airborne droplets, fecal-oral route, vector-borne. As we all know, tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis. Usually, lungs are affected by tuberculosis. Tuberculosis is primarily transmitted through the air when a person with TB coughs or sneezes or speaks and someone inhales the airborne droplets containing TB bacteria. Other options are blood-borne. We all know TB is not transmitted through blood. Next option, I told fecal-oral route. Sometimes TB can be transmitted through contaminated food or water, but this is not the main mode of transmission. I told vector-borne. TB is not transmitted by insects or any other animals. Hence, the correct answer is airborne droplets. That is option B. Next question. In India, which program focuses on maternal and child health? Options are National Rural Health Mission, that is NRHM, Janani Suraksha Yojana, JSY, Revised National Tuberculosis Control Program, that is RNTCP, Integrated Disease Surveillance Project, that is IDSP. The correct answer is A, that is National Rural Health Mission, that is NRHM. NRHM is the program of Government of India. The main aim of this program is to improve the overall health status of rural population by focusing on maternal and child health. NRHM covers wide range of services including maternal health, child health, RCH services, that is reproductive and child health services. JSY, Janani Suraksha Yojana. JSY is the part of NRHM which provides financial incentives to women for institutional deliveries with the aim to reduce home deliveries and associated risks. In simple way, JSY, that is Janani Suraksha Yojana program, aims at reducing maternal and infant mortality by promoting institutional deliveries. The National Rural Health Mission focuses mainly on maternal and childbirth. Next question. Who is known as the father of medicine? Options are Aristotle, Hippocrates, Galen, Avicenna. Here the answer is B, that is Hippocrates. Hippocrates was a Greek physician. He is considered as the father of medicine. Next question. The ethical principle of doing good for the patient is called autonomy, beneficence, justice, fidelity. The correct answer is B, that is beneficence. Other options are also ethical principles. Here, the principle of doing good for the patient is beneficence. We will see the meaning of all these ethical principles. What is autonomy? Auto means self. Autonomy means it is the right of the patient to make their own decisions about their health. What is beneficence? It is the ethical duty of healthcare provider to act in the best interest of their patients than her own interests. Beneficence is the ethical duty of the healthcare provider to act in the best interest of their patients than her own interests. Justice means the principle of equitable distribution of healthcare resources. Then fidelity, it is the principle to be faithful to their promises and commitments to their patients. Next question. Informed consent is based on the principle of, options are non-maleficence, justice, autonomy, fidelity. The correct answer is C, that is autonomy. Autonomy. This principle focuses on the patient's right to self-determination and the freedom to make choices about their own body and medical care. Informed consent ensures that the patients have the information and understanding necessary to make decisions about their treatment options. Regarding other options, we discussed in last question. Next question. Which therapy is commonly used for treating phobias? Options are electroconvulsive therapy, that is ECT, cognitive behavioral therapy, CBT, psychoanalysis, family therapy. Here the correct answer is B, that is cognitive behavioral therapy, CBT. CBT or cognitive behavioral therapy is a highly effective treatment for phobias. CBT focuses on thoughts and behaviors. Other options like electroconvulsive therapy, ECT, is primarily used for severe depression and is not used for phobias. Psychoanalysis and family therapy are used for some anxiety disorders, not for phobias. Next question. A patient with schizophrenia believes that the government is spying on them. This is an example of hallucination, delusion of grandeur, paranoid delusion, thought insertion. The answer for this question is C, that is paranoid delusion. What is paranoid delusion? Paranoid delusion is a type of delusion characterized by irrational and persistent beliefs that one is being persecuted or monitored or targeted, such as believing the government is spying on them. This is the common symptom in schizophrenia. Other options are hallucination. Hallucination involves perceiving things that are not present. Example, hearing voices or seeing things. Delusion of grandeur, it involves an exaggerated belief in one's importance or power or identity. Example, believing that they are a famous leader. Next, thought insertion. Here, the belief is that thoughts are being placed into one's mind by external force. By this meaning, the option C is correct one, that is paranoid delusion.